Hey, everybody, it's Kevin and Thea from RPH Ally on the Remote Care Services Show. Super excited to talk to you guys today about something that Thea had posted a little while back, and it seems like I've had more and more conversations on is pharmacy has been used to a very particular role in different settings. Like, this is what we do. But there's some changes that are happening in afoot, and there's some reasons why those changes are happening, not just based on dollars and cents, but based on how you can sleep at night with the education that you have. So we're going to jump into that right after this reel, and we'll be right back. Hey, sis. So I say it somewhat tongue in cheek, but I honestly mean it. We have this incredible knowledge set. I mean, just phenomenal doctorate level knowledge set, specialist in medications and treatments. And sometimes it doesn't feel like we flex any of that. In fact, talking to some colleagues, recently, it seems like more often than not, we are not using our licenses capacity or our knowledge base capacity 70 to 80% of the time that we're in our work day.
Yeah. And that's really scary to me because, oh man, how many of us still have student loans? How many are still paying for this education that we may not even be using at this point? That's scary to me. And it leaves us in a hole. And how do you dig out of that? What are you going to do?
Oh, yeah. I mean, well, not only how do you dig out of that and what do you do, but, I think that what really matters is how do you make sure the rest of your career is meaningful, to you? The amount of burnout that we're seeing and the problems that we're having. And fantastic. Hey, Mike, good to see you, buddy. And everybody else, it's great to see all of you guys. Thank you guys for joining Thea and I. We always appreciate any insights or input that you guys have for us. And I know that one thing that all of us kind of share is we want to be fulfilled, like in our careers, and doing things that are unrelated to what we were trained on or why we got the training that we did tends toward dissatisfaction. And we've never seen such high dissatisfaction levels, Thea. And I know that you had a post on that. Tell me a little bit more about that from last week, right?
Yeah. And it was really just around like, okay, I want a work-life balance as mom, right? Like I want to be able to be the go-to parent. But beyond that, like, why am I looking for a different? Because I need to use what I have. I don't need more. Everyone's like, pharmacists are scattering out of pharmacy and into other careers and having to start over and do different things. And I say, why? Why are we doing this? Why aren't we being paid for the experts that we are? And I'm not saying that dispensing is dead because we'll always have to be dispensing at some degree to some degree. But I think that when we look at all of the skill sets we do have, we're critical thinkers. How many in the healthcare population professionals can say that they're critical thinkers? I've been around a lot, and I can't say there's a lot of disciplines that are critical thinkers. And so I said, well, okay, that's just the basics, right? Like a critical thinking could be anyone. It doesn't have to have a healthcare background. But when you look at using our knowledge to have conversations with physicians, a lot of pharmacists have never even done this. And it's like, okay, it is new, but it doesn't mean you don't have the skill set you need to be able to go after it and go do it. And I think that there's a lot of understanding new models of care that pharmacists never looked at how to care for patients because we were told this is your lane, stay over here in your lane because you're here to have questions asked to about medication. This is your lane. But our lane isn't that anymore when you have almost 25,000 physician openings across the country for primary care doctors. Like, who are these people getting questions asked? Like, how are they being managed? Who's caring for them? No one. Or maybe there is somebody, but they get to spend 7 minutes with them in a year because that one appointment. Who's answering their questions? We are. So why not look at models that support that and support us to be able to be in that position to be able to do that? And I think care management services do just that, but it also offers me work remotely, have the work-life balance of the go-to parent, use the knowledge I already have without having to go find more degrees, certifications, classes, all of it. More. It's always about more. Instead of finding mentors that can just help you build what we already know to do, we know how to meet patients where they are. We know how to talk to patients and deliver upon education and support for them. We answer those questions every day across whatever venue we work at, it
True.
happens.
Yeah, and I think that we don't even have to read the tea leaves anymore. Everybody is leaning toward this. You see that there are multiple examples of states that are expanding the scope for pharmacists. You see that in other countries, the scope of pharmacists have been expanded. One thing that you don't always see is there an expansion of scope, an expansion of opportunity, and no one jumping into the pool. Very limited, right? Because we have a very strict track that this is what you do. And so I think if you guys have been following us for a bit, that's what Thea and I are always trying to just slightly nudge you into the course of saying, just look at the dollars and cents. CMS in general is seeing there's a reason why RPM and chronic care management continue to get funding, continue to get expansion, and speaking of chronic care management, get increased reimbursement. It's because they work. It's because they're making a difference. And there's a reason why they keep the incident to billing components there, because they know there's ancillary care members that can take advantage of that. And so, Thea, now that we have all these kind of coordinates that are pushing us in this direction, we're seeing that there's a movement of pharmacists starting to take advantage of these things. When it comes to the big barriers of this rising star, you talked about life satisfaction, burnout, et cetera. I feel like the barriers are limited compared to dealing with all of those issues of saying hundreds of thousands of dollars in debt. Now you have to change your pivot of career rather than finding something within the career that you can enjoy. Oftentimes you and I will get, well, there's no practitioners in my area that want to work with me, or we have a siloed integrated system here that's just more difficult for me to penetrate, et cetera, et cetera. Some things that I'm saying, Thea, that I think are really fascinating are there are more and more pharmacies that I'm hearing about that are employing physicians just to get away from that. Just saying, you know what? I don't need any of that. I'm just going to have my own doc, my own PA, my own whatever the case is, leverage Institute to billing in my system, take away the billing headache from them and just let them see patients. So there's a lot of innovative, interesting practices to be able to get away from that. What do you find, Thea, as being some of the biggest barriers to just being able to finally enjoy our careers again and leverage what remote care services gives us?
I think the biggest barrier is mindset. I don't think, yes, it is hard to build those collaborations in that relationship with doctors that you don't know. Yeah, that takes a minute. I won't dispute that at all. It does take time, but it's not a barrier that's insurmountable. It's that you have to have the right mindset to go after it. And I think whether I've been talking to all different kinds of pharmacists, so some that have fellowships, some that have an RPH and they're in their 70s wanting to pivot because they still have more to give, but physically they can't. Like, there are so many pharmacists out there that need to know different. And because their mindset is of the model, I'm not giving up on pharmacy, they're looking, they're finding, they're seeing what is available out there. And care management services is one of many, many things out there pharmacists can do. But I think it has the most potential for meeting pharmacists in our skill sets with our abilities of being able to talk to patients actively and be an advocate for them and really get reimbursed for our time and allow that to be comparable to what a pharmacist knows from a financial standpoint, to be able to replace that income that we're used to and have built up to this area. And it's across the country. It's not my area. It's not your area, Kevin. It's everywhere that it has that opportunity. So it really lends itself, care management really lends itself to that opportunity of thinking bigger. And I think once pharmacists see or hear my love for this, like, I light up when I talk about it, because it literally, I was that person. I was ready to give up on pharmacy. Do I go get an MBA, or do I maybe become a healthcare administrator, or, I don't know, a real estate agent, because I'm over it? Like, those are my options 5 years ago. I said, no. I am enough. I have enough knowledge. I know enough to be able to change the way people see me. I have it. I know what to do with patients. I do. I know how to care for them chronically. I got that covered. Why can I show up differently? And gosh, don't go to the State Board of Pharmacy with that, because that doesn't go well. But when you find a model that is able to do what you want to do, there's so many opportunities. And people think, well, I don't have a doctor near me. Well, I have big UPMC everywhere around me, and I still am okay. Like
Yep.
there's opportunity. You just have to think about it differently. So, mindset. What would it look like if you came to the table and said, okay, I do have excellent communication skills and a critical thinker and no chronic disease states and an expert in medicine? What can you do? What sets your heart on fire? It may not be chronic care management. It may be functional medicine or herbalism or advocacy in its own self, deep prescribing, whatever it is. There's models to get paid for it if you're willing to think outside the box that we were put in.
I love it because I just had multiple conversations over these last few days. The one was just with Chad, in fact, a little while ago from ASCP. Shout out to Chad. They've done some really incredible things with like USA Boxing and getting
Mhm.
more unique relationships inside of communities. And the other day we were talking with Don and I talked with a patient advocate, Sylvia. Wonderful conversation. She was really talking about being a patient advocate means you've got to get yourself out there. You got to go to community events. You got to connect dots. That's the exact same thing with any new services that are going into space. You just can't take a rear end that's in this seat and move it to this seat. You've got to do some groundwork. You
Yeah.
got to build some relationships and you got to be able to find what in my community, what gaps need to be filled with the skills that I currently possess. And just like you're saying, Thea, the gaps are massive. Like it's not like, oh no, I'll never be able to find somebody. Yes, you will. Like
Yes, you
the
will.
primary care world is drowning right now. They're seeing less and less folks go into primary care. The gap between how many physicians we have today and how many physicians we have tomorrow, and the number of geriatric individuals from today to tomorrow, once again, huge difference. And I think that's going to be a massive problem that pharmacists are uniquely suited to fit into. So when it comes to opportunity and mindset, like if that is a hurdle that you're not going to be able to find something, the work is brutally there
Yeah.
for us to be innovative and be able to find it. And the other neat thing I think is this, Thea, from a mindset perspective, when I was talking, I've shouted out Jim a couple times today from Canada, but Jim and I were talking about this. Their model in Canada, specifically, I think it was in Alberta, they want pharmacists to turn their backs to prescriptions. So, in other words, they still want them to be in their world and part of their workflow and all the other things, but they're focusing directly on patients and recognizing that adherence levels matter to bottom line. Levels matter to whatever degree you want to say to DIR fees. All of these ancillary services that need to become primary services are going to matter to your revenue diversity inside of your individual stores. And so hearing that kind of mindset from an individual that works with thousands of pharmacies is really interesting to just finally get that component to be put in place. Turn your back on the prescriptions behind you and face your patients. There's two pieces to that I want everybody to understand. One, it changes the mindset of the pharmacist. You're concentrated on your patient. You're not looking at the phone. You're not looking at your computer screen. You're not looking at the other things that are pulling you away from patient care. And remote care services can offer that. Two, it changes the mindset of your patients and your communities. Instead of you being that person in the back that they never see, they talk to your pharmacy technician, they have no idea who you are. Now the public can start seeing us for the experts that we are and leveraging us in a way that is very fulfilling for our careers and for our communities. So there's my soapbox moment, Thea, but I'm sure you've encountered very similar moments as you're working with clients.
Yeah, and that's exactly it, Kevin. Being able to face the people who need us the most. And that isn't prescription picker uppers. I mean, it's not the patients coming in to pick up their prescriptions. They know what to do. Most of them are probably in their 40s or 50s, taking care of their kids, taking care of their parents. They are busy. They don't want to talk to us. But those patients that come in for those questions is not that population. It
Sure.
is both ends of the spectrum. It's how do I take care of my baby because I don't know anything about this medication, or how do I take care of my parents and all of these medications? Like, what does that look like?
Yep.
And so being able to face them and answer the questions and be there in a model that allows us to take the time for patient care is amazing, to be able to really bring it full circle from a pharmacist who went into pharmacy to care for patients.
Give people this too, Thea. When it comes to the patient population you're taking care of inside of remote care services, I think too often um, it's not a problem. I think on our behalf, but it's just a part of the system because it's CMS. Oftentimes we think CMS, Medicare. That's where remote care services are. I'm going to be working with a geriatric population, and I like serving other populations, so that doesn't fit me. And that's not true, Thea. So break that down a little bit further to be able to expand. Like, here's the scope of remote care services inside of current modern day payment systems.
Yeah, I think there's a lot of opportunity, especially around wellness. Right now, if you're in your 40s, 30s, 40s, 50s, you're really driving for wellness. Um, and a lot of people pay a lot of money for their wellness, from gym memberships to yoga memberships to like all kinds of juicing and all the different things that we put money to make us feel better. This is an avenue that can really help do that too. And so you look at, can I help the pediatric population? Yes, because there's patients that have hypertension issues as children. Like that happens. That is a model. You know, you can go to the wellness center. Maybe it's a mind body wellness center somewhere around you, and pair
Sure.
up with them and offer services like this as a supplement to what they're already doing for their membership folks, and be able to get that revenue coming in a non-insurance based way. Or maybe it is Medicare, or maybe it's Medicaid patients. We're getting a lot more Medicaid patients that are needing a lot more help. You know, when I was looking at recent data that crossed my desk about A1C numbers, man alive, our uncontrolled A1Cs around our region is more around patients younger than 65 than older.
Wow.
How scary is that? Because that's our healthcare of tomorrow. That's our money going out the door because we're not healthy adults today. How do we help people get healthy? One way is to show up for them, whether you bring a device or not. Just show up and answer questions and make them informed adults, healthy informed adults. And man alive, that's full circle.
Yeah, I think everything from understanding that it's not just RPM, physiologic monitoring of blood pressures and blood glucose levels that we're talking about. When it comes to all these remote care services, you know, Thea and I are talking about PCM, or primary principal care management. We're talking about TCM and transitional care management. We're talking about chronic care management. All of these elements that you can start tying in, and they are related to both Medicare and Medicaid. And there's also private insurers that are starting to add on some of these programs. Sometimes they internalize, you know, these individual programs within their insurance, you know, grouping, but you can still look at the needs in your individual communities and get a hold of these payers and say, hey, I can do these things. I've experienced in this. I can do this. This is how the billing kind of mechanism works. They already have the roadmap laid out for them, and you can be innovative and start breaking some ground. And I don't think that we recognize how breaking ground can actually be much easier than, you know, whacking and breaking rocks. Like it's sticking the shovel in, right? But we have abilities to open up some of those doors for ourselves if we want those reimbursement pathways. I see Troy Medicare. I see Good Shepherd Health. I see several that are doing some really interesting and innovative like pathways for pharmacists to take care of patients. So shout out to you guys for doing all the cool work that you guys are doing. But Thea, any parting words, I guess, for folks to say, like, if they want to get started in this, if they want to find a way to do this? I know we've told them before, and everybody, thank you guys for listening to us. But Thea is amazing at being able to break this down. And so, Thea, you have a new course that's out. Tell us a little bit about that.
Yeah, it's the Pivot program, and it takes pharmacists through the integration of value-based care opportunities. That's what it stands for, Pivot training. And it really does just that, offers you the insight into the program so that you can learn more. There's different models available, and what that can look like for you may sit different than it does for me. And being open to learning that is huge, because then the possibilities are endless when your mindset is set on, oh, there is different, and look, there's lots of different, and how can I utilize this in my area with my expertise and what sets me on fire for pharmacy today? It may not be the same as mine. It may be functional medicine, and you can still use care management to get functional medicine paid for you, for your patients, in lots of different models. So it may not be something that I have physically done because it's not what sets my heart on fire, but there's so much when you start looking into what these programs can incorporate. And that's exactly what the program does. It opens the door for you to kind of see into this space of what these care management services are. It like opens the door about this much, and then you can add levels of me, whether you want me as a one-on-one or not. It leverages that door open for you so that you, as the pharmacist looking for different, can find it. It's there in every community across the country, and I can't get to every community across the country for these services. So I think I'm leaving a bigger legacy on sharing my knowledge with all of you over the last 5 years of of the blood, sweat, and tears, I will help direct you away from the blood and tears and right straight into the revenue that we need and are looking for today in pharmacy, and really help guide pharmacy in a new and enlightened direction as the rising stars here around pharmacy services.
I love it. Thank you, everybody, for joining us today. Thank you, Thea, for all the wisdom. And we will see you guys hopefully next week. Have a wonderful rest of the week. If you need any of that information about Thea's courses, she will put it inside a link inside of the description of this show. Talk to you guys then. Bye.
Take care.